I will be speaking about the neurobiological basis and pharmaceutical approaches of addiction in the light of current data. Before neurobiology, maybe I better just take a moment of speaking on addiction. Addiction is characterized by a compulsion to seek and take the drug and loss of control in limiting intake with a negative emotional state and absence of the drug, as we know from the literature. Substance abuse and substance dependence were, differently assessed, but under DSM-5, these aspects were combined. Drug abuse and addiction are actually quite close in definition to each other, but they are quite different. In drug abuse, there is no compulsion. But in drug addiction, there is a repetitive reuse of substance. Therefore, in numbers, we can speak about a differentiation in terms of drug abuse and addiction. This differentiation is quite significant. Particularly speaking for the US population, 51% of the population is an alcohol user, but it's only 7.7% of the population that meets the criteria for addiction. So it means that abuse and addiction are quite different from each other. Particularly, abuse is the first step for addiction, but not all abusers are addicts. As for the studies done in this field, we can say that to understand the neurobiological aspect of this matter, initial studies focus on the positive precursors of or the rewarding aspects of drug. Therefore, the acute aspects are discussed in the initial studies, where drug use is generally compared against no drug use. However, it's not just about a positive predictive or the reward pathway. Therefore, we're speaking about the chronic administration and neuroadaptation processes in the brain in these studies. Well, how about the aims of the studies conducted today? We are currently trying to understand the genetic, cellular, molecular mechanisms for the transition from occasional drug abuse to chronic addiction. Therefore, we will need to look into the underlying mechanisms for this process, and we need to differentiate between these mechanisms. Therefore, in the future, the studies will need to concentrate on chronicity. Well, for a conceptualization, what kind of an outcome do we get? There are generally three classes of conceptualization. The first, this is about the classification of substance effect. The first one is about the intoxication stage, where the individual is getting dosed and get pleasure out of it. Then we get into a withdrawal or the negative effect where they will not be able to find the drug. This phase is followed by a longer preoccupational anticipation, which is like craving in this stage. Therefore, we are looking into a circular presentation of drug addiction, which is like a vicious circle of following one after the other. The mechanism underlying this is firstly starting with a positive reinforcement, because the main reason for reusing the drug is the pleasure out of the drug and activation of the reward pathway. But in time, after neuroadaptation, things would change, and the negative reinforcements will just be in the front. Therefore, we will rather be speaking about drug abuse to avoid negative reinforcement this time. Going phase by phase, we need to look into the metabiological background. Firstly, in the intoxication after acute use of drugs, we look into the mesolimbic dopamine pathway that will be activated in the initial phase as a part of the brain reward system, because you know that there are four different pathways of mesolimbic pathway. Dopaminergic neurons are also comprised here. As a result of the acute effect, this pleasure-oriented behavior is essentially based on the mesolimbic dopamine pathway activation. These studies indicate that alcohol or other types of substances or drugs release dopamine and opioid peptides in the ventral striatum. Therefore, we are rather speaking about a fast and steep release of dopamine. This actually is a detail that we'll need to consider. The pleasure-related effect that emerges leads to the fast and steep release of dopamine. Therefore, to get into the details, there are two ways of release of dopamine, phasic and tonic releases. Tonic releases are most of the time the slow rising and long lasting releases, whereas the phasic releases are about sudden increase of dopamine. Leading to these impacts. To schematize, you can also consider the phasic releases would be like the spike releases or the sudden bursts of dopamine, whereas the tonic releases are rather about the low level but longer lasting dopamine releases. How about the difference in between these two? Why would these matter in terms of the effects? The effects are rather due to dopamine binding receptors and different levels of affinity to these receptors. From D1 to D5, in total, we are speaking about 5 different receptors. D1 and D2 are the two different types of receptors. Actually, dopamine D2 receptors do have a higher affinity. But in terms of addiction or the pleasure reward, receptors that play a part are mostly the low affinity receptors, which are the D1 receptors, which make us think that when there is a sudden rise in dopamine, only then the D1 receptors can be sufficiently bound to, leading to a reward response. But next to it, less but longer lasting release will not be stimulating D1 sufficiently. Therefore, they would be bound to D2 only, preventing the formation of reward. Some studies indicate that activation of D2 receptors in dopamine would rather be enough for limitation of the reward response. That is actually the difference and balance in between D1 and D2 in terms of reward mechanisms. Well, how about the studies? Most of the studies are about psychostimulants like cocaine and amphetamine. Most of them are experimental studies. These studies indicate that in cocaine and amphetamine addiction, in the reward response, mesolimbic dopamine activation is a must to be present. How about our appreciation of this presence? Between neurotoxins and mesocorticolimbic pathway, when you create a specific activity, the DA pathway is blocked, reinforcing effects of cocaine and amphetamine, which means that when there is any kind of mesocorticolimbic pathway blocked, this time psychostimulants reward effects will be disappearing. Actually, the studies speak about intravenous nicotine for a pleasure effect. Actually, this time mesocortical limbic pathway would matter because a lesional blockage in this pathway would lead to nicotine-related pleasure effects. Generally, in experimental animals, self-application is used for testing. But to put it simply, we can speak about an experimental animal that would be given a button as they are given this button as they press it through the system, substances are delivered to the animals, and after a while there will be a more frequent pressing of the button. Actually, the pleasure-related effect will be considered. Here, pediculopontin, nuclear inputs also will need to be considered in terms of this positive reinforcement.
Evet, sadece psikostimülanlar
not only for psychostimulants, but also for ethanol addiction also. Ethanol and heroin or opioid derivative type of addiction is related to the lesions in the mesolimbic dopamine pathway failed to be blocked. They are not blocked. This time, alcohol or in heroin addiction, mesolimbic pathway may not be used. But the studies indicate that within the ventral segmental area, opioid injections, when applied, will lead to a reward response in experimental animals. These two combined, we can see alcohol and or heroin leading to a reward response where the mesolimbic pathway can be alternated. It's true that the mesolimbic pathway in the presence and absence would lead to a response, but if activated, would lead to activation. Therefore, both in terms of the direct activation and the lack of bypass, like bypassing these systems, opioergic system or alcohol may lead to a response.
yine opioid ve kanabinoidleri
Also for opioids and cannabinoids, we can speak about a positive reinforcement. Cannabinoid-sergic system plays a part in this process, whereas the CB1 receptor antagonists prevent the system from being activated.
tek sorumlu bölge
Is it only the nucleus accumbens that is the only responsible area? No, on the contrary, studies indicate that the central nucleus of amygdala has a key function in reward for the as a positive reimbursement. Therefore, we can say that the central amygdala is an important area for central reinforcement. According to studies, we can speak about D1 antagonists applied into CA blocked reinforcement of cocaine. Also, central amygdala lesions block alcohol self-administration as a way of reducing the response. This way, we can say that yes, amygdala central nucleus may also be functioning as a positive reimbursement. One of the important actors there is the serotonergic transmission. 5-HT3 receptor antagonists may also be used to self-administer ethanol in the central amygdala blockage. The point I'm trying to make is, yes, starting from the initial studies, the basic knowledge that we have is in the ventral segmental area to the nuclear accumbens, there is a strong projection. This projection is dopaminergic. Lying in the basis of the reward system, no doubt about it. But the later studies indicate that although this is the central pathway, there are other pathways that would bypass this one. Prefrontal cortex, hippocampus, thalamus, amygdala, nucleus accumbens. The other pathways also would lead to an activation of the reward system. Therefore, we would end up with the conclusion that this is a dopaminergic pathway from A to B. Rather more complicated biology is involved as a positive reinforcement or reward pathway. In the nucleus accumbens, dopaminergic release in cocaine, amphetamine, and nicotine. Also for the GABAergic system, it is important for alcohol and barbiturate addiction. GABAergic activation is important, and the point I'd like to emphasize here is nucleus accumbens is the most important, but not the only actor. Through different systems, nucleus accumbens will be stimulated, leading to a triggering of the reward pathway. Pleasure-related or rewarding effect of the substance is the most studied effect, but taking a more complex look into addiction, we can speak about other factors for reusing the substance. Withdrawal effects also are important. What are the withdrawal effects? In the absence of the substance, irritability, emotional pain, dysphoria, stress, and loss of motivation are also these kind of negative effects. But which are the affected regions? When you get into withdrawal, brain areas that are responsible might be quite different. Amygdala is in the forefront here. Here, central amygdala, bed nucleus of stria terminalis, shell part of nucleus accumbens are important areas. Actually, in the path to addiction, the arousal of withdrawal is a result of neuroadaptation. In the long-term drug or substance abuse, we know that when there is a long term of agonist or antagonist reaction, as a rebound impact, there would be an impact, a conclusion of the process to the reverse direction, leading to neuroadaptation processes. Here, of course, the decreased sensitivity of brain reward circuits to the natural reward can be seen. As a result of this, we would expect a decline towards natural rewards. This means that artificial reward activation of the brain would lead to a lack of sensitivity towards the natural stimulants. This way, the brain would be asking for these artificial rewards. This is actually the mechanism underlying addiction. Well, within the system of neuroadaptations, we can basically speak about two systems: neuroadaptation for system or inter-system. Intrasystem neuroadaptations generally look into the neutralizing effect of the drugs, or maybe we can speak about other opposing effects that are produced for the withdrawal response. Studies indicate that 50% lower psychostimulant-induced DA response can be expected in detoxified abusers. Or 80% lower DA response can be expected in active abusers, according to rodent and brain imaging studies. For active users, you can see that this is more dramatic because the response decline is up to 80%, which means that neuroadaptive change is quite significant in these individuals. Within this system, we can also expect decreased GABAergic neurotransmission, increased glutamatergic neurotransmission, and altered also response. Actually, as a summary, we can say that the situation is either the individual doesn't abuse any kind of drug, so everything would be in some kind of balance in the brain. Whenever there is a chronic exposure of a substance, the balances would be reorganized. So some neuroadaptive changes take place in the brain. In the presence of a drug, we wouldn't feel it, but whenever there is the absence of drug, there is withdrawal, and this time the neuroadaptive changes are rebound with the reverse effects of the drug, pushing the person into negative mood. Also, in between the systems, neuroadaptation also is important. Between system, I mean HPA axis is activated particularly, and also the brain stress system is mediated by CRF. We can speak about the impact, which is in the phase of ACTH, cortisol, amygdala CRF raises. Also, we can expect in the extended amygdala pathway an increased CRF, norepinephrine, and enophrenes, leading to negative emotional state. According to studies, CRF receptor antagonists block stress-like and anxiety-like effects of drug withdrawal. Therefore, we can say that yes, individual CRF is a factor that would play a role both in alcohol, nicotine, and other types of addiction. Another important mechanism is the endorphins. By the way, kappa receptor activity of ventral striatum is increased in withdrawal as a part of the neuroadaptive adaptation. This may be a possible trigger of the CRF activity in VTA. Of course, in the system, there is a stress system, but on the contrary, an anti-stress system. Here we can speak about endogenous cannabinergic system. In terms of the long-term use, we can speak about CB1 receptors, reduced neuropeptide Y and neuroceptin are important actors within the system. Therefore, within the withdrawal presentation, the imbalance between withdrawal and negative effects are important. Stress and the disturbance of the system in the favor of stress would lead to negative effects in the individuals.
Ben majör olanlarını söyledim ama bunun dışında
As for the major factors, these are important, but for the stress and counter-stress system of the brain, other elements are important. Coming to the third phase, this is rather about craving, which is not studied sufficiently, but we need to study more. Craving or expectation or preoccupation. When the person cannot find the substance, so as to avoid the negative situation, a craving period will be started. Can you please sum up? So we need to close. Therefore, this process is extremely important for us. And now, of course, this is a vicious circle, particularly in the respect of negative indication. There is a vicious circle that would follow each other. The most important actor here is the prefrontal cortex. It is where the entire executive functions are controlled. This is where the anticipation rises from. Therefore, impulse control mechanism will be avoided, and as a result of this disappearance, craving for the substance will take place. You can see different mechanisms on the tests where the system is looked into. There are two fundamental craving systems. Number one is by a trigger in the drug or stress or negative state induced craving. Here from the prefrontal cortex to nucleus accumbens, glutamatergic neurons are important stressors. CRF is important here because activation of CRF would put the person into stress. Therefore, there will be a search for the substance. Glutamatergic hyperactivity is the most important problem that we would be facing. Human studies also indicate similar results in the prefrontal cortex. Activity is quite fundamental here. GABA also should be considered because barbiturates and in this barbiturates of like substances. Prefrontal cortex GABAergic activity are important changes as a part of the system here. Insula is also important for food, cocaine, and nicotine craving. Therefore, insula shouldn't be forgotten in recraving. Now I come to the key points of my presentation. Well, briefly, I can summarize the fact that substance abuse are based on three stages: intoxication, withdrawal, and craving, which is a vicious circle. Once the person is inside this vicious circle, it becomes more difficult for the individual to get out of this vicious circle. In addition, neuroadaptive changes are also relevant, and this neuroadaptation process plays a key role. Stress, anti-stress balance in the brain impaired would be a significant problem. And also, in terms of the craving of the drugs, cognitive defects are also considered to be an important part. Therefore, prefrontal cortex and executive functions are to be controlled by subcortical areas of the brain. So far, we have known many things about addiction, but it's due to intoxication, which are the acute effects. But now we are speaking of mechanisms in neuroadaptations, and especially preoccupation and anticipation are still unclear. Therefore, future studies should probably focus on these aspects as well. I would like to thank you very much for your attention.